Hello and welcome to this presentation of Waitcheck, a simple and effective solution for improving the patient experience in emergency waiting rooms. As you know, emergency waiting rooms are often crowded. Patients can wait for hours without knowing where they are in the queue. This creates anxiety and stress, not only for patients but also for medical staff. And the risk of contamination or the spread of disease increases. Why not find a solution to relieve some of the congestion in emergency waiting rooms? First of all, what's a patient's journey like when he arrives? He takes a number, then waits to speak to a nurse, then he speaks to a nurse, then again he waits his turn to speak to the doctor. This is where things can take a long time, but things can change, and the person in charge of triage makes sure that priorities are respected. It can happen that an ambulance arrives, or a child arrives, and priorities can change again, and again, and again. That's where Waitcheck comes in. We developed this solution after observing the reality in a local hospital, where some patients were waiting up to 10 hours. Waitcheck enables patients to track their position in the queue in real time, directly from their smartphone or computer. No need to register. Patients simply use the number they receive on arrival at the emergency department. This number is anonymous and allows us to track their progress without divulging any personal information. For hospitals, the platform offers a simple, gamified interface, where staff can easily reorganize the queue thanks to an easy, intuitive system. Too easy to be true, isn't it? Let's see how it works. Here's a demonstration of how a patient waiting to speak to a doctor can track his resting position in his car. He chooses his province, then the hospital. He enters the number he's been given, and he'll see his position online in the queue. Instead of spending 10 hours or more waiting without knowing his position, the patient can track his position while resting in his car, at home, or anywhere. Simple, right? Here's a demonstration of the queue management tool, specially designed to simplify the work of medical secretaries who call patients when it's their turn. To add a new patient to the queue, simply enter the patient's number in the form and click on Add. The patient is immediately placed in the queue without any further steps. Secretaries can rearrange patients according to priority with just a few clicks. Simply click on the corresponding button, or use the arrows to move a patient up or down the queue. When a patient is ready to be taken on, you can simply click on the Remove button to remove the patient's number from the waiting list. Everything is designed to be fast, simple, intuitive, and uncomplicated. Thanks to this simple interface, queue management becomes easier and more efficient, allowing secretaries to concentrate more on their normal tasks. Practical, right? The benefits are many. Less overcrowding in waiting rooms, less stress for patients, and better flow management for hospitals. What's more, in times of health crisis, such as during COVID-19, Waitcheck reduces the risk of contamination by enabling patients to track their position remotely. Together we can improve the experience of patients waiting in emergency rooms. With Waitcheck, waiting becomes more human,